The Local 3 Storm Alert Team, accurate forecast for your day.
It's probably fair to say that most of us now know pretty well the risk factors and lifestyle habits that we need to be aware of to help prevent various types of cancer and heart disease. Those get a lot of attention, and rightly so. But now that we are in the month of March, doctors across the country are focusing on our kidneys, something a lot of us don't really think too much about or know too much about. Dr. Aditya Bhartia is with the Tennessee Kidney Care in Cleveland, and he's going to educate us this morning. So nice to see you.
Well, thank you for having me over.
I have learned quite a bit actually over the years because we do a lot of things with kidney disease here on the show. And what has surprised me, I think, Dr. Bhartia, is how more common it is than most of us really realize. There are a lot of patients watching today struggling.
Yes, kidney disease is growing pretty rapidly. And I think the most common cause being is like people are unaware that they have kidney disease because most of them don't have symptoms. And with the rising number of cases with diabetes and high blood pressure being the two most common causes of kidney disease, we are seeing a lot more cases of kidney disease.
So that's kind of a worrisome thing for all of us to think that there could be something lurking within and we don't know it because there are no symptoms. So how do you find out that you have it?
So most common test is just a simple blood and urine test. So they can check the serum creatinine in the blood and a urine for protein in blood. And that's a simple way to find out.
So, I mean, we're kind of going to get personal here, but if you are not having any issues when you go to the bathroom, does that necessarily mean that you're free and clear?
No, and that's the most common misconception. Patients think that, oh, if I don't have pain in my kidneys and if I urinate okay, my kidneys are functioning fine. And unfortunately, that is incorrect. I mean, your kidney function, you could be in like stage 4, stage 5 kidney disease, which is the last stage, and still have no symptoms. So the only way is to kind of follow up with your doctor and get your kidney function tested.
So you mentioned a couple of things. One of them was diabetes, which is a big deal around here. Does that then make you more prone to developing kidney disease if you're diabetic?
Absolutely. Diabetes and blood pressure.
Is that true for type 1 or type 2 diabetes?
Correct. Type 1 more so than type 2.
Okay. And blood pressure. Okay, that is something doctors will often say, make sure you know your numbers. And one of those numbers is your blood pressure. But we live in this stress-filled world. So are more of us walking around with high blood pressure than we realize?
And that is probably true. And so, I mean, you know, patients say that, oh, I'm stressed out today. My blood pressure is 160 or 90, but I'm just stressed out. But that may just be what your blood pressure is outside of just stress, so keeping it under control is very important.
Okay, so probably again with the education component, we don't know a lot as lay people about kidney disease. When we think about the topic, one of the first thoughts we have is dialysis. Is that always the course of treatment?
That is not, and now patients fear to come to a kidney doctor because they think that they're going to end up being on dialysis, but the sooner you come see a kidney doctor, the less likely you will end up on dialysis.
Really?
We're here to prevent patients from going on dialysis. So the sooner you come in your disease course, the less likely you will end up on dialysis because we'll be able to, you know, we may not be able to reverse your kidney disease because sometimes it's not reversible, but at least slow the progression of the disease so you do not end up on dialysis.
Okay, so like the ABCs of this thing, step 1 would be going to your primary care doctor and making sure that those creatine levels are being checked. Is that right?
That is correct.
Okay, so if it comes up with a clean bill of health, you're good, just keep up what you're doing.
That is correct, and just make sure you maintain your diabetes and blood pressure and don't take some common medications that's harmful to your kidneys.
Oh, like?
The most common being ibuprofen, Motrin, Aleve, Advil. If you take it on a regular basis, then they can cause some kidney damage.
Does regular basis mean every day, once a month? What does it mean?
Once a month, you know, here and there, weekly is okay, but if you take it on an everyday basis because you have headaches, migraine, for sleep, aches and pains, yes, that can cause severe kidney damage.
Okay, I have a couple of minutes left. So step 2, let's say that you've got the high level, so they make an appointment, they come to you. The earlier the better, and if it's not too far advanced, then what are you going to do? Help with lifestyle changes?
Yes, lifestyle changes, you know, stressing the importance of your diabetes and blood pressure control, you know, will help change some of the medications, put them on some medications to again slow the progression of the disease. You know, the better they are educated, the more likely they're going to take this seriously, the diabetes, blood pressure, and kidney disease, you know, diet modifications.
Do you ever begin a patient on dialysis and then they're able to wean off of it?
Yes, it is definitely possible. We do see that and many times. Again, it just depends on what caused that kidney disease. If it is just uncontrolled diabetes, then less likely for them to come off of dialysis. But if it is something else, you had diabetes but you got COVID infection and it caused severe acute kidney failure, yes, your dialysis can be reversed.
And in some cases, that dialysis can be performed at their own home.
Yes, so actually dialysis can be done at home and in the dialysis clinic. And actually, I mean, doing it at home has been out there for years, but just in the last decade, it has got more popularity for different reasons. And actually, that is a better form of dialysis than doing it in the dialysis clinic.
Okay, so in terms of getting people to you, your office is in Cleveland, right?
Yes,
what you
we
do
have one
all
in
day, every
Chattanooga
day.
also.
Okay, Chattanooga and Cleveland, and what they do all day, every day is care for your kidney. That's the name of the business, Kidney Care Center.
Yes.
Does it require a referral to come to you?
No, it just depends on the insurance. If the insurance don't require referral, we do take walk-ins or self-referrals.
All right, so kidneycares.com is their very easy website. There's the Cleveland number, 339-3340. If you can't get to Cleveland, you can call that number and they'll help you with the Chattanooga office as well. Thank you.
Thank you.
Your time is important. Local 3 News Today has everything you need to start your busy day. What's happening now and next? The local experience and knowledge to help you prepare for the day. Accurate hour-by-hour forecasts and traffic, making your mornings easier.
It's 2024, and men all around Chattanooga are celebrating the difference the men's clinic has made in their life. If you're struggling with ED, we want you to be able to celebrate as well. As men, we hate going to the doctor, but the Chattanooga Men's Clinic was designed to take care of guys just like you. Today's the day to feel alive again. Guys, it's time to feel amazing and crush this new year. Call my team right now and let us treat you to an unforgettable experience. Dial 423-402-9720 or go to ChattanoogaMen'sClinic.com.
I got hurt in a car wreck. Give me one good reason why I should call the Insider.